Hey everybody, welcome back to the Optometry Money Podcast, where we're helping ODs all over the country make better and better decisions around their money, their career, and their practices. I am your host, Evon Mendrin, certified financial planner and owner of Optometry Wealth Advisors, a financial planning firm just for optometrists nationwide. Thank you so much for listening. And for the new listeners, welcome to the show. On today's episode, I have another great guest, Dr. Ryan Gustus. Ryan is the co-owner of Eyecare Associates in Indiana and also co-owns another business on top of that, LensQuote, serving private practices. And this episode was a lot of fun. Ryan and I talked about his experience buying into a practice right out of college. He talked about how he learned to be an owner and learned about leadership. He then described some of the frictions and areas of improvement that he sees in the patient experience and in the sales process within a practice. And we go back and forth to talk about how optometrists and really any related helping professional should think about sales in their work and in their businesses. Lastly, he describes his experience building a second business on top of co-owning a practice and ends off with a few take-home action items. And all the books and resources mentioned in the episode are in the show notes, which you can find at the Education Hub on my website. You can scroll down in whatever app you're using and you'll find your way there. If you've enjoyed the episode, share it with your peers and leave a review. Any information and feedback you can provide is super helpful in improving the show and making it a better and better resource for you. So if you have any questions or thoughts about future episodes, shoot me an email at Evon, E-V-O-N, at optometrywealth.com. And check out my website, optometrywealth.com, and you'll find this episode and all the other ones we've done, as well as articles we've created. You can schedule a no-commitment intro call while you're there to learn more about how I help ODs proactively monitor and plan around their finances, from taxes to cash flow, student loans, and beyond. And lastly, stay on the lookout for announcements coming up. I'll be doing a webinar next month with Eric Matei of Acrinos, which will be an awesome conversation, I think. So I'll be getting more information and getting it out to you as soon as I have that information with me. So keep an eye out for those announcements. But without further ado, here's my conversation with Dr. Ryan Gustus. And welcome back to the Optometry Money Podcast. I am here with another awesome guest, Dr. Ryan Gustus. Ryan, thank you so much for coming on today.
Thank you for having me.
Yeah, I really appreciate you coming on, and I've been excited to chat with you ever since we connected because I think you have now, 10 years, at least 10 years practicing and also in practice ownership. Mm-hmm. And I think you have an interesting background and experience in getting into partnership and learning how to become a partner early on in your career. And then you've also on top of all that, you've also started another business serving private practices. So I want to dive into both of those aspects of your career and your professional life. But before we dive into that, I just want to get a little bit of a background. What got you into optometry as a profession? Why did you choose optometry?
Yeah, no, right away, the egotistical part of me was like, oh yeah, happy to talk about myself.
At least for being honest, that's great.
No, this is the opposite. That's the uncomfortable, other than thinking, well, hopefully this helps. As you know, I've been involved in various things to this capacity. So yeah, no, I enjoy talking about this kind of stuff. So what got me into optometry, it kind of went back to college, knowing frankly, I think I went into undergrad thinking I just want to go to med school. I'd done some shadowing around physicians and thought, doctor would be the way to go. And then I decided to be a physics major for some strange reason. I think I saw a chart somewhere that like 70% of physics majors got into med school, but realized later that was because it was 10 people, and 7 got in. So it's like, oh, well, that's how that worked. So anyway, then while I was in undergrad, as I was kind of evaluating where to go in medicine, I had been a lifetime practically contact lens and glasses wearer, so it fascinated me some. But I will say that I did get married early at 21, and lifestyle and family and things like that really weighed on me, wanting to be able to control my schedule. Didn't want, on call as much. And I really didn't like, and this will inform things I did later, I really didn't like how much of, if you're in other medical professions, largely insurance was the number one driver. The hospital system was the number one driver. You just had less of this business opportunity, so to speak. So I really liked that kind of healthcare and retail aspect of optometry and being essentially a doctor, but then you also got to be more of a business owner too. So that's what drew me initially to optometry.
Yeah, and at school you mentioned your family. I hear consistently, time after time, that the family life that optometry allows is a big part of why so many people are happy to get into optometry versus other medical careers. So I think that's really cool. And so you graduated from IU back in 2011, is that right?
That is correct. And then did a residency in ocular disease at the Fort Wayne VA hospital, which actually happened to be back in my stomping ground. So we were looking to settle back in this area, and kind of blessed to have a really good ocular disease residency here, because I had decided fairly late that I wanted to do residency. And so it all worked out that it was here. And then I was looking to stay in the area.
Yeah. And then 2012, you bought into the practice that you're currently at. Is that right? So essentially right out of college, you're jumping into practice ownership.
Yeah.
How did you, I mean, you could have gone, you could have built a career as an associate. I mean, you could have even cold started a practice. How did you know you wanted to buy into a practice and get into practice ownership, especially right out of college?
Yeah, I think first is, if you just have an ignorance to money and debt, then you'll just pile on the debt.
Got it.
No
Okay.
for anything. I think that's the number one. Okay.
The less you know, the better off you are then, business ownership.
That's right. Yeah.
Got it.
Bills get paid somehow. I don't know. Yeah, it was. So actually, even in my fourth year and in my residency, I had started the plans of, starting cold, which is very hard to do, frankly. I'm kind of glad it didn't turn out that I had to do that, because in retrospect, I'm much happier that I bought into a practice. And the way it worked is a little bit unique. And I think everyone has a little bit of a unique story when it comes to how they found their way to practice ownership. Mine was that there's a very strong practice locally here. Now, to explain my area of the country, I'm in northeastern corner of Indiana. Our major city is about 360,000 people. And then there's several other, smaller towns and cities that are 10,000, and there might be 40,000 people in a county. So, and even though we have a school here in Indiana, there's still a bit of a shortage. And even when I was coming out, I had quite a few potential opportunities, but I digress. So anyways, so I just knew that I really wanted to own a practice. I wanted to be in control, I guess. Wanted to control my hours, control what I can make, control the quality care, et cetera, et cetera. And so this opportunity came up. Now, how I knew about it was that I worked with the doctor who ended up selling me his half the practice. He was part-time at the VA and was looking for an exit from practice ownership and wanted to do a full-time, basically be a residency director at a different VA. And so that connection really helped. And then in a kind of nepotistic world, my residency director happened to be the spouse of my future partner. So there was a little bit of, so sometimes when people are like, wow, you get guys kind of like, it's almost like a fast getting hitched scenario. Like, how do you guys pull that off? And I think the unique situation, which I think is important to know for people to say, oh, wow, how did that happen so quickly? Should I be trying to do that quickly? And I would say, only if your situation dictates. Mine happened to be, I kind of dated my partner's, wife. She approved of me and really talked through things. And I knew the other exiting partner, why he was exiting, and knew him well. And then through them, plus meetings with my future partner, we would have dinners, and, I'd go visit the practice. I was able to moonlight some in the practice while I was doing my residency. And in the end, it just seemed like a very positive relationship that we could manage. And so really I finished, I think it was like June 30th. And then I was in my practice I owned then the practice the next day. So I finished my residency on a Friday, signed the papers on a Saturday, started work Monday.
Wow. That's a quick engagement. Yeah.
Very quick.
So again, coming out of college, this is outside of your residency. I mean, this is your first real job out of college. You don't know what you don't know. And all of a sudden, bam, you own half a practice. Mm-hmm. How did you, at that point in your life, look at and evaluate the potential partner for the practice you're buying into? Because I think partnerships and adding on co-owners is one of the more trickier parts of business, and all the dynamics that go into that. I mean, you're potentially at a different stage in your career than your future partner. Maybe you want different things for the practice, have different visions for the practice. So how did you look at that to figure out, would this make sense for me from maybe from a personal standpoint in having a good connection with your partner, and also from a financial standpoint, if that was on your mind at the time?
Yeah, it was. It was kind of all the above. I think what helped me in this decision process was at least being fairly firmly committed to, I really wanted to own, like basically start my investing early by investing in myself, by owning this, by owning an entity. And then in that, kind of dating phase where you're starting to look at the numbers and doing the math, then you can, kind of comfortably say, okay, this is what I've talked to a bank. This is what the loan is. This is what my loan payments would be. This is my, what I would service those loans for. This is my take home pay. And then here's kind of a chunk of money that is like my mystery money, is that, I probably have things that I'll need to buy within the business, or, a new OCT or whatever it is. I didn't really know, but, I kind of just roughly looked at that and said, okay, this is a number that I can comfortably live on, afford, health insurance for my family. My wife wasn't working any longer. She'd been a teacher previously. Mm-hmm. Not that her health insurance was all that great to begin with. The cheapest child to have is under the federal health insurance, by the way.
Got it.
We had one, and then when we saw it cost like $100 to have an additional child, we're like, well, we're going to have number 2 right now.
That's some advanced financial planning for anyone listening. Yeah. So for just add on some children.
Yeah. It's a good thing to plan around. So I digress beyond that stuff. So that was kind of I felt comfortable enough with the money to say, okay, I'd be making enough, plus betting on myself to say, here's a practice. And at the time it was now 2012. So we were kind of crawling out of the 2008, recession at the time. And seeing that, there's probably things I can do within the practice to also just help grow it. But certainly one of the advantages that I had was that I had an exiting partner whose schedule I was assuming, right? He was leaving, I came on, boom, I have a full schedule. And so that was an advantage. And that was kind of an opportunity. Well, I guess not doing that practice was basically an opportunity cost relative to starting cold, right? I mean, you can, I could start cold and have it be my whole show. However, what was the opportunity cost for that? Well, over here, I had a full schedule right out of the bay, this is a practice that's been around for now 90 years. I'm owner number 7. So we have a lot of longevity, a lot of very loyal patient base. So I felt like I could adapt to that. And then frankly, the personal side is that I guess, I did get married at 21. So I guess I will commit easily to things. Say, oh, you're right. All right, let's do it. Let's do this thing. But no, I mean, my personality type is I'm very high. I really get along and empathize with people fairly well. And I'm only saying that because tests have also told me this, but I've had that inkling all along. And I think I've been very lucky having a partner that is 19 years my senior. So he was in a different part of his career and is always in a different part of his career. But that I got a sense, at least early on from him, that he was always interested in growth, was interested in, having someone else kind of help take the reins. that he could slide back a little bit while, kind of giving me the free rein. And I give him a lot of more credit than I think I've ever told him, in the sense that, I think that's a brave thing. I think that, I don't know if you're asking me the same thing these days. I'd be like, I am pretty good at delegating certain stuff, but it is hard to give the reins over, especially someone that just signed the dotted line on Saturday and now they're here on Monday, officially your partner.
Yeah. I definitely hear that one of the biggest, or one of the most important skills to learn as an owner is to delegate, is to be able to take things off of your shoulders, keep on your plate the things that are highest value to the practice and that are that your skills are necessary for, but delegate a lot of these other things. But that's also one of the hardest things to learn is how to delegate. It sounds like you and your partner had that figured out pretty quickly. How to rearrange those tasks and making sure you're involved in the business, and it sounds like you got going pretty quickly there. Mm-hmm. So it definitely sounds like you did some of your own financial planning. You needed to make sure that it was feasible for you to buy in, that your expenses were covered. How did your wife feel overall about you owning the practice? Because there's a lot of extra stuff that comes with that.
Yeah, that's probably a good time where ignorance is bliss. Whereas a little bit of what are you doing? Oh, sure, go for it. Or maybe we're just exhausted with 2 children, so we couldn't spend too much time thinking about all of that. No, I think we're very in tune with each other, and knowing that by having a business, and yes, it's there's other adage. I'm trying to use the right word. Adage. There we go.
Yep.
You can edit that, right? Where I mispronounce it 5 times.
Or we'll leave it in. We'll see.
We'll just leave it in. Why not?
Yeah.
So an old adage about being a business owner and who really runs the business, you or the business. And but I think she believed early on as well that owning your own business, you control your own destiny to some degree, and betting on yourself, and that will hopefully give you more latitude and control, and more financial, a solid foundation going forward. So pretty bought on it.
Yeah. And so what surprised you about owning a practice? Did it meet your expectations that you had before going into it? What surprised you about that whole experience?
Yeah, it's such, you're surprised all the time. You probably should be, not in a negative aspect, but it's even while I was in school, my buddy Aaron McNulty, shout out if he's listening. We had started the private practice club at IU when we were there. So it was 2008, 2009. So I was very involved in wanting to do the business, owner aspect, or know everything, know as much as I could going into it in advance. But there's a difference between learning about that in advance and then once you're actually in it, right? Mm-hmm. You think there's probably, at least for me earlier on, there was a lot more of this is a numbers game, and in the sense that, I can tweak this number or add this service or blah, blah, blah. And magically other numbers pop out the other side that are better. And there is truth to that. It's not incorrect. You have to buy that piece of equipment to be able to build that fee and then build that into your schedule, and you'll benefit from that as well as your patients. However, you got to, train someone to do that and have a system in place and, putting all that together. So I'd say the thing that maybe surprised me the most was just how much later my people skills really have helped, how much I've leaned on those to be really, empathetic with staff and empathetic with patients, and just having kind of a deep understanding. And then years later, I wish I'd done this more earlier. Earlier was more tactical, how do recall systems work? And that's not to shame anyone that's looking at stuff, because you got to start somewhere. Awareness was great, but I would say if I were to criticize myself, I probably spent more time than I should have at the time trying to figure out what my future recall system might be, or how to sell 2 pairs, or whatever those things are. I was aware of these tactics, but then once you're in your practice and starting to figure out who's in your practice, how it works, who's your patient base, who's your staff that you currently have, I would have probably invested more time reading more books on leadership, more books on behavioral psychology, which is what, then I spent, like the last 6 years on, studying pretty intently is, how do people think about how you think, and putting it all together. Because then a lot of things that both your staff decisions that they make within your practice, a lot of those things make more sense. Things that patients do with your treatments, with your sales, whatever, their things make more sense. And you can start, I think once you really start understanding how people think, that really is where some of that growth and your own happiness comes from. Because no one likes to be stressed, and when you don't know what's going on, it's stressful.
Yeah, and I think everyone wants to start. Well, not everyone. I think most of us want to start with the more technical aspects of building and growing a business. I mean, it could be just more exciting or interesting, and then we can talk about systems and processes all day. But the reality is, the business, it's the people that actually carry out those systems and processes. It's the people that you have to be aware of what the culture is of the practice, and you have to be in tune to how those people are in relation to their work and their peers and their jobs. And so, how did you learn to become a leader? How did you learn to get better at practice ownership? For the listener who's maybe just getting into business ownership, how do they learn to be a better leader and practice owner? Is it just reading books and applying what you're reading? Is it lessons learned through experience? I mean, how did you get better at that?
It's a good question.
And on the next episode, we'll talk all about.
Yeah. I mean, I'll do two. I'm trying to pick out maybe a couple things in mind, because it's such a soft skill, right? So it's tricky. It's not everyone's strong suit. Some people are more, just the way you're built, affects how you are as a leader and how you should approach being a leader. And that's one of the tricky things too, is there's not a real great cookie cutter guide to say, I should say there are guides that say, be this way and you'll be a better leader. But what if that's not the way you are? There's different ways to be leaders, right? Or if you're not a great leader in this particular, zone, whatever that zone is, within the practice or something, being able to appoint and hand that over to someone to lead, so leading can look many different ways. I would say from just a pure tactical standpoint, maybe this is my own fascination with how we think, but start with a, personality test. There's Myers-Briggs, there's the DISC, they're like $20 to $50. I think, I don't know if they still do it, but J&J did like a more in-depth one way back when I was in school. They would send students there and run a test. That was my first exposure to it, actually. And it's both enlightening and a little bit, surprising or frightening, however disconcerting, that there's only so many real personality types out there. There's only like we all like to think we're very unique, and then you can do these personality tests, and it really kind of gives you some good insight on, oh yeah, I do think that way. Oh, I didn't realize that was a weakness of mine. And I'll give an example here soon of what mine is. But on the same token, then these reports can spit out all these other things about you, the way you think. And it's like, it's kind of eerily accurate, because I only answered like 20 questions and it spit this answer out.
It tells you your whole life in 20 questions, huh?
Yeah. So maybe I feel a little less unique now, in the sense that everyone can apparently be boiled down to 20 questions and fit into a grid of 4x4 personality types. But things like one of my weaknesses is a strength of mine is I never. I don't know how to cover up or lie or anything. Like I don't ever have an ulterior motive. Whatever I say, I'm always being truthful with whatever it is. Not in like an a-hole way where I tell people what I think. I'm very empathetic to others, so I'm not going to spout off anything. But I don't really have a mode wherever I think that I should obscure something or not, or something. It just doesn't occur to me. Likewise, people doing that to me, it would never occur to me that maybe someone were hiding something or lying or something like that. I don't know that. So it's a good awareness to have. Not that I've ever had much experience with that in the past, but I'll say, very early on, I had a staff member that I was just so perplexed by, because I'd hear one thing and I'd see another thing. And then eventually I learned, oh, that's because that person was lying. And I just said, I couldn't figure that out.
Wow.
It wasn't in my brain. Why would they do that? It just doesn't occur to me. So self-awareness. So I guess where I really come around to, it starts with being self-aware of yourself. So I think self-awareness, having a lot of it helps, and really trying to learn all about yourself and how you think. And then once you have a base of that, then you can start learning how other people think. And I really, you can personality test all your staff if you want. But I think just reading books on this particular topic, like Robert Cialdini and Influence is a good one. Adam Grant is very well published. Think Again is another one of his. Malcolm Gladwell has some very interesting books that make you think differently. Outliers and Blink, and
The Tipping Point, I think, is another one.
Tipping Point's another one.
Yep.
He has several. Authors like that really help flip a light switch for me to kind of really say, wow, there's this bigger world out there of, I'm self-aware, but I had less self-awareness of others. So I think that's a great way, to become a leader and then by doing, and there's no better way of doing than just to jump in and just start failing fast if you have to.
Yeah.
Because you'll learn quickly too. You'll quickly start learning things.
Yeah.
So that would be my own experience, and then also maybe a little tactical way to approach it if you're so inclined.
Got it. And we'll throw all those books and everything you mentioned in the show notes. And going through that experience, you now have, you've gone through that experience as an associate or as a non-owner doctor buying in, and you also now have 10 years of practice ownership. If you were in the seat now where you were adding on another associate into your practice to buy in, how would you now, with all your experience, evaluate that potential partner? What would you want to see in that other doctor that tells you that that's a good fit for your practice?
Yeah, that's you had mentioned that question, and they're like, "Yeah, we'll figure it out on the air."
Yeah.
And I was like, "Yeah, that is actually a very deep question." The very the narcissistic side is immediately to say, "Hey, find someone that's really driven and wants to work really hard, and has a lot of the same things that a lot of same interests that I have in moving things forward." But that's a little bit of a short-sighted, thing. Really, it should be that you're looking for people that do things, different things better than you, right? So that's probably one of the things that, I'm still close enough to the beginning of my career than the end. So I'd be looking, me personally, for someone less to take over my role and more to supplement as an owner, or to have some complementary, skills. I do think regardless, though, they have to be motivated, a motivated worker. That's just one of those things that I think is hard to quantify to some degree. So since I haven't hired or brought on a partner, aside from when I was a partner, I guess I'd have to think about that more. But I think having an awareness of what it might take to run a business, having the motivation and really wanting it. I do think I can read motivation fairly well but I've only accumulated that over time. Because I think a lot of other things come into place. Like, I think someone could approach me with a certain amount of debt, and knowing what my practice is worth right now, I could tell them like, this is about where you'll be income wise. Is that comfortable enough for you or not? I think those things are a little bit easier to quantify. I think, I guess, and then the last thing would be just, it probably does come back to self-awareness. I think the first thing I would look for is someone who's just continuing to want to learn, because understanding that there's going to be a lot to learn. So anyone that came in very self-assured that they already had the answers, I would be very, mindful. I'd be like, I don't think you realize that there's a lot that you're going to learn. Not that my answer is the right way. It's not that I'm giving you the answers. It's that if you feel like you're bringing the answers, I think that's a little bit of a problem. But if you're bringing the work ethic, the creativity, and some ideas, I think that's worth its weight in gold. And then that's the kind of person to go all in on, or allow to have a piece of your company, which is a big thing.
Yeah, that is a big thing. And I like what you said, because I think for me, having heard an answer to that from a lot of different business owners, a lot of service business owners, my own profession included, and the first idea is to replace yourself as a practice owner. Find someone that has your qualities, your skills, your temperament. Just sort of find someone that's just like you. But I think what you said is and something that I've heard a lot of people say is the better approach, which is find someone that actually brings on complementary skills to what you bring. Find someone that hedges or that strengthens your weaknesses, that can add something to the practice. And it starts with that self-awareness that you talked about. It's knowing in the first place, okay, what are my strengths? What areas do I need to strengthen up? Where does someone else fit within this, machine or ecosystem that is my business? And it does all start with that self-awareness. So I love that answer.
Thanks.
Yeah, we'll keep that one in. We won't edit it out.
We'll keep that one. Yeah, don't edit that one out. And that was a little
gotcha.
that was thinking on the spot, and I was worried about the whole time. Like, gotta really think.
One last question, and it is a little bit of a general question, but I do just want to hear what you've seen in that. In your 10 years of experience, what areas, maybe one or two areas, do you feel like practice owners could and should improve on within their practices? What have you seen?
Yeah, practice owners as a whole. So this kind of goes to then, my background in both, like earlier on, coming into practice ownership, I'd like work on the state level, and to some degree, it kind of, again, was born out of my unique situation of, I really wanted to own a practice. I happened to have these connections, and everything worked out. So right out of the gate, I'm a practice owner. And at even, 2012, it was a pain point. There's less private equity around. So actually it may have even been a bigger pain point at the time for retiring doctors looking for younger doctors to buy. So my partner was a former state president, and had done all of that for numerous years. So I was looked at as like, hey, junior partner guy, we have some programs and things that we could use a young, whippersnapper type to offer some, input on to these retiring doctors that are really struggling and wanting to find, people like you to then, buy their practice. So I've been kind of like involved kind of casually or, in those kinds of efforts and having conversations and things. And then, but then I will say, what's been interesting is private equity. Not that problem still doesn't exist. And whatever you think about private equity, I'm just saying that, I think for retiring doctors that were looking for an exit, it became an additional exit for them. So, overall, not that problem went away, but I guess I heard about it less. So anyways, that's a whole nother topic. Mm-hmm. To come back around to what independent owners could do. So then this then goes into, then we founded a software platform, right? And we do consulting and all these other things. And where did that even come from? That's another longer story, but it was kind of born out of things that we were doing in the practice. Felt, it wasn't just us. We had other friends with a similar need. So we built something scalable, which the nameless thing is LensQuote, but we built something scalable that then other colleagues could take advantage of and use in their practice. So I had it goes back to my high interpersonal, loving to interact with people. It was kind of like my continuation of having done private practice club early and working with practices later. And then, it's the kind of furtherance of that interest of mine. And so through that experience, so I bring that up to say, so through that experience, I think one thing as independent practitioners that we are could use more time thinking about is that in-office experience, that friction with your patients, friction with your customers, and friction being anything that's slowing them down in your office, negative interactions, just any of those things. Because I'm trying to keep this generic and not specific to like our business, but like to give an example, people, well, let's put it this way, your patients, I say this in a good way, they kind of want to be done with you when they come through your office. I even kind of wrote an article about this, and it sounds,
ouch.
Kind of a negative, but not really. Think of it in this sense. They want to feel complete by the time they're done, right? We're all in a busy world. There's so many things going on. I have so many things on my checklist. So does everybody. So to come in, through and have to, schedule multiple appointments, or, come back to pick something up, or, whatever it is, if they're not done, then you really satisfied all their needs. And so like in our example, we really are working on, helping practices sell more annual supplies. Because really, does that person really want to have to make this purchase again in 6 months, which is usually somewhere else, right? I mean, that's an incomplete thing that they haven't been able to check off their list. But a lot of practices, that person gets up to checkout. They know they need a year's worth of contacts at some point. Staff member says, oh, how many boxes do you want? Oh, I don't know. How many should I get? Well, with your insurance, blah, 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 it's this. And, in the end, they just don't have any confidence to buy from there at the time. So they feel like, well, I'll just settle or whatever my insurance covers at the moment, and then I'll figure it out later because I've been too confused. There's too much friction in the sales process. You're making me come back in and, pick up the contacts, trying to sell me sunglasses, which I hear about that a lot. But curiously, and if anyone ever hears, I don't mean to sound offensive on that front, because I do know a lot of colleagues like to do that. However, I want the evidence of how many sunglasses are sold on that visit to come pick up the contacts, or compare that to why not sell them while they're there in the first place. So it's things like that is around the customer experience within your office that I think we could spend more time thinking about how we would want to have that interaction if we were in their shoes. And what could we do to improve that and make that more smooth? Because frankly, it's not like vision plans are doing us any favor, or insurances are doing us any favors. It is difficult to sell things in a retail healthcare environment in a way that's not confusing. I mean, look at glasses, prism, and different lens indexes and different frames and this and that. It's hard to boil that down to where the average person can understand or feel like they're not confused. You're just trying to avoid a feeling of confusion and uncertainty, so that leads to confidence to buy from you. So I think that would be one of the biggest things, and kind of a corollary to that. And I'll stick in the contact lens realm a little for this. We have a lot of conversations, or I see a lot of conversations where people are fixated on pricing contacts. And this is our Profit Assist, or our other business that kind of does the consultation of pricing and strategy, and with like with a lens retail business. But overall, where this kind of came from was we'd see a lot of talk about, I've priced my lenses a certain way to, beat out 1-800 contacts or Costco, whatever it is. And then there's, other offices that might be higher priced. And in the end, a lot of them sell about the same. Or they were here and then they lowered their price to be more competitive here, and it really didn't amount to much more in the way of sales, if any. And part of where I say to that is, well, it's probably something else in your practice, like these customer experience things. So stop thinking that, oh, if I lower my price some, now suddenly these sales are going to happen. If anything, this gives you license to raise your prices, because there's plenty of studies that say people will spend 20% more for the same product from someone that they like. Not even that you offer any advantage, they just like you. So if there's studies proving that, and don't you think you're liked by your patients, then why not make more off of that same business that's in your office, knowing that you can, and knowing that you're losing those other sales probably for a different reason that has nothing to do with price. Then you can focus on fixing those things.
Yeah.
The communication and experience and everything else. So I'll get off my soapbox on that, but those are some of the messages I like to spread out there into the ether. And I'm not I'm there, I like to think we're very good on the contact lens side within our practice. There's always things that we can do better too. So I'm not saying that we've got it all figured out, but that's what I always keep in mind every step of any change that we make in our own office.
Yeah, and I do like that focus on the patient experience, because in that there's so many parts to that, because that starts as soon as they find you online. Like, how hard is it to find you? How hard is it to schedule? How hard is it to go to your office? How hard is it to park, to get seated, to go through pre-testing, to see the doctor, to get handed off to optical? Like, every aspect of that is a part of the patient experience, and there's probably frictions all over the place that can be tested and improved on, and then on the sales side as well, as you mentioned. So I love that focus on the patient experience. And I want to talk to you about your business, LensQuote, because you own a private practice, which now is opening, I think, a second location.
Yes.
Right? Okay.
Yes. So full disclosure, am I not in a different location right now because we were moving stuff in the other practice location, which is where I was, and then the internet went out. So anyway,
okay.
It's 10 days away. No stress at all. But anyways, yes, opening a second location.
So you're opening a second location. Hopefully everything's functioning on doors open. Yes. So you've got a practice with 2 locations now. Hopefully your family wants to see you at some point throughout the weeks.
Oh, yeah.
And then now you've co-started a separate business serving optometrists. What was the genesis? What is the genesis of that second business of LensQuote? What was the genesis? What problems are you trying to solve there?
Yeah. That's and it's going on 3 years now, which is kind of crazy to me. That is a little bit of that entrepreneurial journey from the beginning. Say, okay, I really love to be in control and do all these things, and I like building stuff. Frankly, I like to build processes and do things. And I think you see that a lot in the office and then through our software. So pretty much the origin story, more or less, of LensQuote was that, what is it, 5 years ago now, 5, 6. So, it was taking a look at the financials of the business and to pull financial planning into it. So looking at the financials and said, hey, look at our contact lenses. Wow, we only sell about, 40% annual supplies. That's weird because it seems like we're priced very competitively and they could just be done when they're here in the office. Wonder why that is. And so it started with kind of that question. And then the answer at first was read every article that I could to come up with a perfect script that we developed with our staff. And for like 3 months, we honed it. And then we were doing this new process. And then when we measure the results, we raised our annual supplies by about 5%, we went from 40 to 45%, which was like a victory sort of. And yet it still didn't quite make sense. It's like, wow, that's a lot of effort for a little amount of growth. So then around that time was then, of course, the all the consumer behavioral psychology stuff that I've been researching for a while. I have some background with being able to code some things, and then just really looking to get more efficient in the office. So I created this kind of first version of LensQuote to say, well, we're talking people's ears off. At the least we can do is make this pleasing visual presentation, which is what it was at the time. And I just thought I was saving my staff time. And we went from the first month, went from 45 to 65% annual supplies. And that was pretty much the light bulb to say, not to start a business with it, but the light bulb to say, okay, we've really come onto something here. As simple as it sounds, come onto something. So we refined it, we built it out. Didn't do anything professionally with it yet, but I had friends that wanted to try it. We put it in friends' offices. They had similar results. And so then there came a time to say, I know what the industry average is, like 35% annual supplies. A lot of us are in the same position. I've found something that works. and we can, have it built to be, a professional, scalable thing. And so that's essentially what we did. So we hired developers and build it out as a company to then, make it something that then others could have access to, and that at the same time we could take and keep tinkering and adding and building in new features and making it better overall. So it's been very rewarding. It's been fun. It's different. It certainly helps. And maybe this is where you're getting in to the question of, do I ever see my family? I do. We just did a trip to the Smokies. It was great. But if you're to ask what my other hobbies are, I'd say, well, it's basically, having businesses. My hobby is that, and I have another hobby. So yeah, my hobby time is either my practice or LensQuote, depending on which lens you want to look at it. Both, I enjoy both equally, and I do both. So I don't really have, other than coaching my kids' sports teams, I enjoy doing that too. But yeah, and just getting efficient and building teams around you that can help support those endeavors. But really anyone can do it. It's just, it starts with an idea and just kind of sticking with it and being stubborn enough to keep at it for long enough. And then, eventually things will probably work out, was my approach to in all things.
and you've talked about frictions in the sales process, and you've talked about your experience with your own practice and building LensQuote. I mean, where are those areas of frictions, I guess specifically in the lens area of your practice that you've been seeing? Like where can practice owners really improve that whole sales process? Even if we're just talking about the contact lens side of the practice, what is that?
Yeah, I would say some of the examples I gave earlier would be I'm actually a big, strong advocate of stocking lenses, which sounds like I'm moving backwards in time 15, 20 years. But, everything becomes trendy again eventually, right? So here we are, we're moving into a recession. Perhaps, I don't know, maybe. But here we are moving towards it. So things that we can do to address our cost of goods would be, something that we should look at. So, and stocking lenses, yes, you're putting forward cash up front for inventory, but you also usually get a lower cost of goods, obviously, for those that you buy. And then usually there's a pricing program aside from that. Usually in order to do that, you need to be a little bit more streamlined with your contact lenses as a whole. So, are you split 4 different ways between manufacturers? Are you 3 different ways? Ideally, you should be more 2 with a third, like a small third. But I see a lot of practice that are split 4 ways. And that's through our Profit Assist consultative arm. So anyways, so where I'm going with that is then also at the moment, while they're in your office is the best time to capture, right? Because you offer the most convenience at the best price right then. They don't pay the same price if they buy 6 months now and 6 months later. They don't get that rebate, that all the companies offer. If you offer a discount, they don't get that. So now is the best time, and nothing is better than here it is already in your hands too. That's the quickest speed of delivery. So you've got, and what you don't know, perhaps about your patients as well, is that they're a little bit nervous about things to come, but they thought that they're going to need to put braces on Junior, the other day, but the dentist said, nope, we're going to wait a year. Junior doesn't need braces yet. Well, now I feel like I've got this money in hand. I'm absolutely willing to spend at your office. And you can't know that, but the best way to find those things out are to be the most convenient, just have everything there ready to go, and away you go. So it has a speed of delivery, a cost of goods. It has difficulties to it too. There's inventory management there's involved. You need to have a system and a process, but really it can be a strong win, both because for a patient experience perspective, but also perhaps if you're one of those people that are spread too thin across 4 different manufacturers, maybe that helps force you to focus a little bit into streamlining your business, because you have to if you're going to stock something. So that would be, I don't know, kind of a hot takey tip kind of thing, that it's like old is new again. If not that, then drop shipping everything. We did that years ago. All of a sudden we just said, all right, we're shipping everything in-house. People loved it. That was one of the first things we found no negative impact on sales or anything. And, that would be a very streamlined thing. And then just really making it easy for them at checkout. We obsess over that. It's very hard to do because a lot of times a lot of information needs to get to that point at the same time to make it a smooth process. I'm sure other softwares and things do it better, like EMRs. Ours will remain nameless. It's okay, but it seems like 15 boxes need to be checked before we can swipe that person's credit card. Trying to make that happen not in front of the patient as much as possible, with as little of them seeing behind the scenes of, oh, we needed to click this button to file something, taking all of those away from being front and center for them and just making that transaction extremely quick and extremely easy to execute is those would be areas that I think practices really focus on and would win.
And you've clearly studied consumer and sales psychology. We would all believe here, listeners, and Ryan, you and I would believe that clearly optometrists have a valuable service and have valuable products for their patients and their communities.
Very.
Do you feel like optometrists and their staff and associate doctors are comfortable with the feeling around selling their services and their products? I mean, what have you seen around that?
I would say what I see is generally we don't like it. Yeah. It's Steve Vargo. Shout out Steve. He does a lot of great work, and he's written several books that I would highly recommend to anyone. I really like to riff with him when we get on a call. It's just fun, but it's part of it is let's put it this way. I would say that it is true that it would behoove you as a doctor to kind of learn the skill of selling to a degree, because you're not just selling glasses or helping sell the contacts, you're helping sell your treatment plan and things. But selling isn't quite the right word either, because you're really trying to influence that person or trying to change their behavior. Basically, you're trying to make some kind of behavior change in all of those instances. And that can be hard because there are all different personalities, both doctors and patients. There's different strategies that work better with some than others, and some just have those skills better than others. And then what I would say is we default as physicians really to be more of the customer service, like healthcare provider that we went to school for, not to be the salesperson that's trying to profit from things. We need that to run our business. We understand that in order to give the great service that we have, we need to have money in our bank to do that. So we do need to do those things. But what I would say is, as both a word of inspiration or a challenge, is to say, the doctor doesn't have to do the selling though. I mean, I understand the selling from the chair. Some people do it very well. Some people, I've heard other colleagues put a lot of pressure and guilt on themselves that they don't do it well, and then felt like that was their only avenue. Now there's, you can really work on, having the staff offload certain things. And I would also say that, patients don't really like to feel sold to anyways. So are you actually doing too much selling and talking or things, or have you, would it be better to spend more time on the presentation or the marketing, or just making it easier to understand what it is you're communicating, instead of saying it in, 2 paragraphs, cut it down to 10 words and give them something physical or visual, to go with. Those are the kinds of things that I think, equates to improving sales or selling, but that are less uncomfortable. That if you can position yourself more as we say with the LensQuote to a degree, we're trying to take your salespeople and make them better, but we're not necessarily making them salespeople. We're kind of trying to position them as more of the customer service person, which they feel much more comfortable with. And LensQuote in this example is the salesperson. So you can put sales on inanimate things, You can,
Got it.
you can,
Got it.
you can explain what's, on this screen or this or that. And it's a different position. And yet overall that person has been communicated with and quote unquote sold to. So,
Yeah. Yeah. I think any, optometrists, financial advisors, any helping profession, I think naturally has that reaction to sales in general. Any truly helping profession has that reaction because we want to provide care and advice for the best interests of those we're serving, and that is a great quality. And I had that. I mean, I would have had that reaction years ago when I've just started my career, and I've seen business owners literally squirm in discomfort when just mentioning the word marketing and sales. So I've seen how people react, and what I've learned is that every business requires sales in some way. Every nonprofit with the most noble causes there can be requires some sort of sales. Sales itself is neutral. There's nothing good or bad about it. I think what we're all feeling terrible about is bad sales practices, because there are a lot of it. What we really don't like are bad ways of selling. And that's, I think, a mindset that we have to take on, is that sales and marketing are neutral. Our businesses require it. And it's just really about guiding someone from being a non-customer to then making a decision. And the right people we want to guide to make the right decision for them. And the people that aren't a good fit for whatever our services are or products are, we want to guide them to go a different direction. But we're just guiding people through a decision-making process. And ultimately, we want them to make that decision. I mean, do you agree? Do you have a different feel about what sales is, just like neutrally?
No, I mean, I think you said that very well and concisely. That I don't know. I would say one of my personal things is it's very weird to me, like selling something to my colleagues, frankly, right? Like when we were really small and early, well, how was I going to communicate anything? Well, I had to, we had to have a website and kind of a system, and I would do demos and I haven't done any of those in a while, obviously, but like that was tricky for me. And here we have this platform that's supposed to help my colleagues also have sales. So what really helped me through all that is, one, I'm not here to sell anything. I'm here to educate and communicate. I just look at it now as part of a continuum of a range of sorts, where, on one side there's, the hardcore selling, Brian Tracy of old. If you don't know that name, you can look up that one. That was like the ABCs of selling: always be closing, hyper aggressive, that's, that I don't think very few optometrists resonate with that. Certainly I don't. And on the other side is that you're so afraid to be selling something that you don't end up even communicating with your patient, and they feel lost in the whole thing. And so somewhere in the middle is where you're educating and informing. But I think where the opportunity lies is that a lot of us tend to educate and inform in a way that we best understand it ourselves. And we need to always be thinking, or try to think, in how do we communicate and convey that message in a way that they best understand. And, like marketing, as a whole, and I think that's another thing we don't get a lot of exposure to. And certainly I've learned a ton about it in the years working with professionals that do it. Is it's really all about trying to figure out, how to best communicate with your customer in a way that they understand. And so I've kind of, lumped all of those, at least from a communication standpoint, together, and that it's really just about educating, but focused on how they're going to understand it versus how I feel like it comes out best.
Yeah. So it's about improving our own communication. I think we all forget about the fact that we know these things so well. And, we talk with our peers about them, and we have a certain way of talking about it in a really technical language sometimes, all that jargon and stuff. And I think we forget that, okay, we need to pause and really break this down in a way that our patient's going to understand, so that they can make a decision, and they can understand why that decision's right for them, or not right for them, if that's the direction.
Mm-hmm. The curse of knowledge.
There we go.
I forget who coined that term.
Ryan Gustus,
yes,
I
it's a
think,
thing.
right? Well, can we? No.
No, it
Okay.
didn't. No. I read that from I think it was like Daniel Kahneman or something. There's one of those behavioral psychologists. There's another book, Thinking Fast and Slow, Daniel Kahneman, Richard Thaler.
Nudge is a great one.
Another great book. Yeah.
Well, we'll get all 60 books we recommended in our show notes. So we'll bulk up your Amazon lists, listener.
Yes.
And I guess as we sort of close the conversation here, I want to try to narrow down a few takeaways that sort of sums up everything we talked about in a few like action items. Like what, and I'll just leave this in your court, Ryan. Like what are 1, 2, or 3 things that the listener can take away and say, okay, I can apply this tomorrow. Maybe not today. We'll give you the day off, but tomorrow in our practice.
Well, tomorrow's
we are
Saturday.
Recording on Friday, so okay, Monday. We'll give you 2.
Oh, that's true. It depends on when you're releasing.
We'll give you 2 days.
So these are takeaways that they can, try next week and to improve something, right? I think just let's, instead of an action that happens, let's do like a learning, like learn something in your practice or about yourself. So if you're, just starting off or a bit younger, I think trying to find one of those personality tests, if you haven't done one before, do one and just be fascinated with the fact that you can be boiled down in a certain way. And then I think the Myers-Briggs one does, it also helps you understand how you interact with others a bit more than the DISC, but there's a little bit tactical. But I would just say learn about yourself. I would say if you're in a practice, either as an associate or a partner, I would take pick a narrow area. I think we get into too much paralysis analysis. I certainly fall victim to it a lot, but try to pick just like a very narrow thing for 1 week to say, okay, this is how we do our, confirmations for patients, right? Something like that. Like what's our no-show rate and how do we do our confirmations right now? And just learn about it. And you'll probably hear things already that you're like, oh, I didn't know we did it like that. Even without, the likelihood is you'll probably not hear what you envisioned. And now you learn something. And then now you can take that and either add your own flavor to it or spend some time researching, and there are lots of, resources you can just Google, like optometric management and thing. There are talking heads out there that do talk about things like that and then implement. And I would say test. What I like to get more colleagues involved in is thinking like they taught us way back when, to be kind of like a researcher where, you try a treatment and then see how it goes, start off with a base measurement and then try this new thing and then measure after the fact. That would be something that would be interested to get started on that process, but keep yourself narrow so you're not stressing yourself out. There's my actual takeaway.
Love it. Okay. I really appreciate that, Ryan. And where can people find you and follow you and learn more about what you're doing?
Oh, heck. I'm on LinkedIn. So Ryan Gustus, I'm on LinkedIn. I'm on Facebook. You can friend me on there. Our website is LensQuote.com. Our new service is LensQuote.com/profit assist. If you feel like you'd like some help with your contact lens pricing and retail strategy. And email is ryan@lensquote.com. So if you have any other questions or thought, doesn't have to be contact lens related, I'm usually up for a good call or chat or something along those lines. So I could be reached any of those
Got
places.
it. We'll put all that in the show notes. And if you have any questions, listener, feel free to reach out to Ryan or me about anything we talked about today. In the meantime, Ryan, really appreciate you coming on. And for the listener, we'll see you on the next episode. Take care.
Thank you for having me.
Want more resources to help master your money? Check out the Education Hub on Evon's website at optometrywealth.com. Evon Mendrin is a certified financial planner and owner of Optometry Wealth Advisors, a California registered investment advisor. All opinions of Evon and his guests are their own. This show is for informational purposes only and should not be relied on for specific investment, legal, tax, or other decisions. Clients of OWA may own securities mentioned on this show.